Right now, medicines are given like candy. Patients are seeing doctors for 5 minutes and they're given a pill. It's my belief that many of the medications that doctors are giving to patients today are more harmful than helpful to those patients.
They want that pill that they hope will take care of their problem thoroughly and rapidly. And most of these medications will actually do that very well in the short term. In the short term, they really work. The problem is in the long term, they're mostly disastrous.
This is crazy. It's very clear to me after having studied the science that the way we use psychiatric drugs do vastly more harm than good.
I remember driving my niece to school and I was like, all the kids are gonna be murdered. And then like that thought created adrenaline. So then when the adrenaline kicked, I was like, oh my God, am I gonna be the one that does it? And then it's like, yeah, Ándzhi, you're gonna kill these kids. And then I'm like sitting here looking at my niece like, I can't, and the thoughts are so bad that like your like teeth chatter. Like, oh my God, I'm capable of that? Are you kidding me? I was never like this. That's the scariest part because I don't know, is this my normal? Like, did Effexor do this to me? Did Cymbalta do this to me? Did Geodon, Abilify? Which one? Which one did it? I started thinking like, okay, when did this start? How did this start? What led up to like me falling apart? Like I was the go-to person in my unit always. If they needed a job done and they needed it done right, they would ask me. I was physically fit, knew my job. I got promoted to sergeant. After work, I was like a lot of fun. I liked to travel, go to the beach, spontaneous. I was just like the happy person, like the happy-go-lucky friend. Like, hey, let's go shopping, let's go to a bakery, let's, you know, never had a second thought about anything crazy. That's who I was before this. So when the war started, I think most of it was stressful situations every day, like being shot at on convoys, just driving around in dangerous areas of Baghdad. Your head was like constantly like scanning for something dangerous. Be a strong sergeant. I don't take no shit. That's just the way I was. But like the first 2 months I was in Baghdad, like I'm really, really sick. I had nosebleeds, fainting, dizziness. I lost like 40 pounds. So they medevaced me out of Iraq. Then my convoy got hit the day after I got medevaced. And so I saw the kid come back in and he was one of my soldiers and I felt horrible. And like that was the day that I saw psychiatry with the arrow and I walked straight there because that's what you do. I don't know. And they put me on Klonopin.
Right.
That's how this all started.
They're trained while they're on active duty very, very systematically that if you come back and you have problems, you need to go to the doctor. 100 years ago, if they had this kind of a trauma, would talk to their fellow soldiers, talk to their parents, talk to their friends, talk to their pastor, and instead they're going to their doctor and getting medicated.
And I think the Klonopin was starting to make me worse, but they just kept telling me that's what PTSD is. You have PTSD now. And then I remember he looked at me and he said, we're gonna start the proceedings for medical retirement. You are not able to be around soldiers and no weapons. And I remember feeling like, how was I like super soldier and now I'm disabled at 25? Are you kidding?
There is a post-traumatic stress, and it's a problem. So we would never argue with you that it's not a problem. It is a problem. It's a big problem. But for you, it's not a mental illness.
Like, I feel like I'm waking up from a nightmare. Like, what the fuck just happened to my life?
You lost years of your life. You lost your career. There's just so many things that are losses in here. That's part of the situation that we're in right now as a culture, is that if you run to the doctor and cry about this, they're going to say, oh, you have major depression, and you're going to stick you on the next pill, instead of saying, hey, you know what? Suffering is the only normal response. There's a grief process that you have to go through.
Yes.
Wow.
When I got out of the Army and went into the VA system, it was like a whole nother ballgame. It turned into like cocktails of antipsychotic, antidepressant, benzo. I would say to the clinician, like, I don't have good feelings. All I just feel is numb or anxious or depressed. I don't ever feel happy or grateful or like loving. And then, oh, we'll just add another medicine. Maybe that one's not working. So then we'll switch to a different one. So basically my medication history is just a succession of, oh, this doesn't work. Let's go all the way up to the highest dose and see what happens. Okay, it didn't work. Okay, come back down. Okay, that didn't work, so let's switch it and try another one. It's like a hamster wheel that I never got off of until now.
What happens to someone like Άντζι is that when they get on these medications and they begin to deteriorate, the attribution is to their mental condition as opposed to the medication. And so when they go in and they say, well, you gave me an antidepressant and now I'm really depressed, then they say, well, I see your depression is worsening. And so they up it or add a medication. Next thing they're on uppers and downers. And I mean, you just see this pattern. And every time they go in, it's their deteriorating mental condition. Instead of somebody saying, your drug may be your problem.
Nice to see you. Nice to meet you.
You too.
Thank you for coming.
It's awesome to be here. I'm so nervous because I can't talk like this at my own school. So I want to just like run through my story quickly and then just talk because I'm sure you have like really cool questions. I was on a cocktail of 17 medications at once. And then basically from 2006 to 2016, it took me all that time to like get off of everything else.
So every time you went in and you were prescribed some of these medications, what were you told about the side effects? How much information were you given before you were prescribed this medication?
In the office, you have 10 minutes with the psychiatrist. That's it. So then they're like, so how are you feeling today? And then you're like, well, I'm still really anxious and I didn't sleep last week. And then they're like, well, I want you to take this little quiz. You know, do you feel jumpy in public? You know, do you spend time with friends? Like, it was just one of those psychological assessments, right? So I'm just filling out the little test, and then he takes the test, and then I see him pull out the DSM, and then he's like, oh, yep, you have generalized anxiety disorder. And I'm like, what is another label gonna do for me now? Like, really? Another label, thank you. Now I have addict, PTSD, generalized anxiety, panic disorder with agoraphobia, major depression. Like, for what? What does any of those labels do for me? Nothing. I'm doing everything that you tell me to do, and I'm not getting better. So the most hurtful part of all of this that I want you to listen to is that I did all the therapy. I saw social workers, therapists, psychiatrists, psychologists. Not once did somebody say, it could be your meds. Not once in 13 years. That is what hurts me the most. And now I'm in social work school. I have all A's. My brain is coming back. I can write a mean APA paper. Yeah.
You were talking about, you know, a lot of these meds that are being prescribed for 4 to 6 years should only be taken for a few weeks. Do you think there's ever a place for medications, or would you ever hold someone's hand through that decision process?
At the beginning, I was like anti-med, like no way, hell no. Because I'm lucky that I didn't kill myself or someone else. So like, how can I like say, oh, go ahead, take those meds, you know? And like, there is times when some people, and when I say some, I mean like very few. So I'm not anti-med, I'm pro-informed consent. So if you as a social worker want to talk to them about informed consent, that is like well within our boundaries. We get it for surgery, why aren't we getting it for meds?
You shared that you're very uncomfortable with all the labels you've been given. If you could change that label to something, what would you?
I just think I was just scared. Like I was just a scared little girl that was 24 and like, it didn't have to be so complicated, you know?
Typically, we find that the withdrawal phenomenon is the opposite of whatever the drug does. If the intention of the drug is to help somebody be more relaxed or help them fall asleep, then when they're experiencing withdrawal, what they will experience is anxiety and restlessness and insomnia. It may even get so bad that they, are profoundly depressed and consider suicide.
The withdrawal symptoms can often be much worse than the original problems the person came with. And the withdrawal is very, very difficult, sometimes quite dangerous. It may take months or years to really be accomplished. People are jumping out of their skin, feeling terrific anxiety, having all sorts of physiological symptoms that are difficult to bear. People cannot stop this medicine except in the slowest possible way with very gradual reductions in dose.
We go into this field because we want to help people, but it's very difficult to know where to turn for unbiased evidence on these issues. The pharmaceutical industry has tremendous influence over what doctors learn, how they learn it. So general lack of knowledge about the dangers of these drugs is one of the main reasons that doctors continue to prescribe, even when they're inadvertently causing their patients harm.
So he got killed in action a month to the day after I was medevaced out. So now I'm processing this grief 13 years later, which most people would say, you should be over it by now. But, you know, I just had to call one of my soldiers and be like, can you tell me the story again? Because the last time I heard it, I was on drugs and I didn't feel it. So now I need to sit by him and think like, look what this war did to us, and feel it.